Hi, I'm Dr. Eric Westman with Adapt Your Life, and I'm here with Dr. Sean.
Dr. Sean O'Mara.
How are you doing?
I'm doing well, Dr. Westman. How are you?
Thank you for coming out today.
Super excited to be here. It's a great event.
You have a practice where people can come see you. Can you explain to me
I
where
do.
that is?
So we're located in Plymouth, Minnesota. We're close to General Mills, right down the road. And we got started about 8 years ago as a research practice looking at reversing chronic disease. And since that time, we've evolved into a practice that focuses not only on reversing disease and improving health, but actually increasing human performance. So now I've kind of retooled myself. I'm a performance optimizing physician, first physicians in that particular space. So the way we operate is that we invite patients to come in. We do some baseline studies using a safe MRI where we measure biomarkers inside the body, some important ones that are far more associated with reversing disease and optimizing health, such as visceral fat. We quantify it, pericardial fat, and then we take a look at cerebral arteries and disease presence within arteries. We provide patients recommendations on interventions on how to reverse those biomarkers. We also measure fat and muscle ratios. And we bring patients back after about anywhere from 2 to 6 months, sometimes sooner, to detect changes, and it's a very useful methodology. We received a grant from the National Science Foundation about 2.5 years ago to fund our research, and now we have a clinical practice on the side that we take care of clients. So it's a great strategy.
Yeah, how do you look at the nutritional approach to what you do?
So our plank that we found to be most effective is to get people on a high-fat, low-carbohydrate diet, the keto diet. Super excited how much it has grown, especially recently. Got started in it over 8 years ago, and I was the lone wolf. I was an MD out advocating a high-fat, low-carbohydrate diet, the Paleolithic diet at that time, and then keto. And it was a really hard thing to be an MD trying to advocate that. But now that's our chief plank, using nutrition. And then we also work with some other interventions such as optimization of the microbiome, getting people to eat more clean, avoiding food preservatives, and optimizing their sleep, optimizing their exercise program. But nutrition is really our number one starting point. We get people starting on the keto diet, and also incorporating intermittent fasting as well.
That's great. You know, in my practice, it's more of a diabetes, obesity. If someone really wants to do a marathon or something, that I outsource. So I think I may be able to send you some people.
Great,
what would be
the
perfect patient or person you like to work with? What is their profile?
The ones that I really enjoy is my passion is working with people who really want to get healthy and really improve their performance. I help them get really healthy and really improve their performance.
That's what I'm thinking, the marathon level or
typically it would be somebody that oftentimes it's a professional athlete. It'll be somebody who's an Olympic athlete, or an executive athlete like a CEO of a corporation who really has a livelihood where their return or their income is predicated on how well they perform. But my second passion in life is just taking people wherever they're at, turning them on to the advantages of getting healthy. So I like to work with people that just getting started and are only marginally interested in health. Maybe they're very overweight, maybe they're diabetic, maybe they've been plagued with a lot of disease, and I help them to make the lifestyle changes, what they should do to help build on improving their health. So really, I'm in a wide spectrum of patients to work with, and we're excited to have any patient that comes through our practice that's interested in getting more healthy.
Great. When you start thinking of athletes and low carb or keto, I think of the movies Serial Killers, C-E-R-E-A-L, not S-E-R-I-A-L, and then Serial Killers 2, where Sami Inkinen, who started Veer to Health, he and his wife are keto adapted, and then they row in a rowboat from San Francisco to Hawaii, and they break the world record by 15 days.
Yeah, he's awesome.
Yeah, unbelievable. And of course, that's out of my league in terms of teaching. I'll bring people who, most are sedentary. I'll take them from not doing anything. Of course, they don't have to exercise to lose weight, which is a shock to a lot of people. But then they start walking and getting back into it when they have more energy and all that. But the Serial Killers movies I think of as a great accessible resource for people.
Yeah, it's really becoming more mainstream. I also am in the military. It might be obvious. I just recently returned from a deployment from the Middle East with the Army National Guard here in Minnesota. And it was a great opportunity for me to work with soldiers that are interested in increasing their performance. So the receptivity now in the younger population to this is super encouraging to see. And from a military standpoint, we now see a lot more officials in the Pentagon and Department of Defense taking a look at healthier strategies towards eating with a view towards increasing human performance. And that's an interesting population I enjoy working with as well. So the military, and particularly special operators and special forces, are really taking a serious look at nutrition and how you exercise and some of these other things. And it's having dramatic impact. So I think we're going to see a migration from the military into mainstream. We're already seeing, social media playing a huge role in the keto lifestyle, and I think it's some exciting years ahead, even months ahead, what's going to be happening.
There's a study going on. Duke is collaborating with the group in Tampa, University of South Florida, Dom D'Agostino.
Oh, yeah.
And that group, and they're looking at divers and the oxygen. The idea that you need less oxygen when you're on a keto diet, it has applications in areas where you're trying to push the extreme and you don't have a lot of oxygen. And I know that it's ongoing research, but which doesn't mean it's helped yet, but the idea that you can maybe high altitude or underwater applications just by changing the diet might enhance things.
Oh, yeah.
Are there any other situations? Well, TBI, traumatic brain injury, is another military. Well, and then there was another study on just having people lose weight in boot camp, whether they would lose performance on a keto diet, and they didn't. They lost weight and they did as well.
Right out of Ohio State University, I think
Jeff
you were referring to. Yeah, Jeff's study. Yeah, I think we're going to see a variety of applications. As more and more people go ketogenic, we're going to see greater insights into how it really optimizes human performance and increases the level of health that we see in ways that we probably can't even anticipate at this time. But clearly this is an exciting time period to introduce the concept of high-fat, low-carbohydrate and the keto lifestyle to the general population to take a look at, and I'm just excited to be a part of it.
I'm really appreciative of you to take the time to be here.
Sure,
Thank you.
absolutely.